Good afternoon. I call this hearing of the Senate Communications and Technology Committee to order. I would like to welcome everyone to the second of 4 hearings of the Communications and Technology Committee to discuss how we can better improve access to high-speed broadband internet throughout the Commonwealth. Before we start, would like to begin with a Pledge of Allegiance. So, Senator Hutchinson, if you would.
Please join me in the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Thank you so much to Senator Scavello for offering to host this important hearing in beautiful Monroe County. And as we drove up this morning from Harrisburg, I remarked that it was 58 years ago last week that my parents honeymooned here in the Poconos. So nice to be back. By way of some context, this time last year, the number we all were using with regard to the number of people who were without high-speed internet was about 800,000. So the number of people without access to high-speed internet across this Commonwealth, and I can tell you that about 25,000 of those folks were in York County, where I represent. We now know, thanks to the Center for Rural Pennsylvania, that actually only a small portion of Pennsylvania meets the Federal Communication Commission's minimum speed for broadband of 25.3 megabytes per second. The number of people without access who have a discrepancy in actual speeds versus advertised speeds, they believe is in the millions. This particular hearing will dive deeper into healthcare and emergency response and how a lack of broadband access impacts those specific areas. And we all know that broadband is important for so many reasons, but we also know that it can become a public safety concern if someone cannot access 911 services or a pacemaker can't sync with a physician's system. And that's why I wanted to hold a hearing to specifically address and discuss those important areas. We must ensure that our residents that live in the most rural areas of the Commonwealth have access to life-saving emergency response and health care, as well as access to high-speed broadband. And that really is the first step to make that happen. So today I would like to offer the opportunity for Chairman Scavello to offer a few welcoming remarks. Senator Scavello.
Thank you, Senator, and I truly appreciate you picking this area for this hearing because it's one of those areas that, you know, we have the possibilities here, people working from home if they had the high speed rather than commuting to New York and New Jersey. So for us, it'll keep people home closer to their families versus having to commute into New York, which is sometimes a 2.5-hour trip. The Senate District today to discuss the need for greater broadband access in rural counties like Monroe and Northampton. High-speed internet access is critical for quality health care, like the Senator just stated, educational institutions, businesses, students, and their families, and first responders. I'm excited today for today's testimony and for continue to work on solutions to close the digital divide between rural and urban communities. As many of you know, I've advocated for increased access to broadband technology for many years. We all know how important communication technology is in the overall quality of life, especially in rural areas of Pennsylvania, where physical infrastructure is often out of reach. In the 40th Senate District, we have made headway in several cases with getting increased broadband across to specific communities and institutions. However, we need to replicate that success across the state and make it the norm, not the exception. Today, we will hear how broadband communication is a critical component in providing our communities with adequate public safety with the conveyance of internet technologies and broadband wireless communications. Public safety emergency communications undergoing tremendous change and growth. However, without proper access to broadband communications, the challenges, for public safety officials and the emergency service organizations to prevent, prepare for, respond to, and recover from emergency incidents. As communication technologies become more advanced, public safety organizations stand to benefit from the capabilities that broadband networks will have to offer. The time is now to implement this important technology so it can really work and save lives. Studies have shown that communities without access to real-time data experience a 25% higher rate of lost lives, injuries, and crime. The use of broadband technology changes the game, and the broadband enables the emergency services to utilize one integrated network for coordinated response times, thereby allowing for quicker access to emergency services so that the first responders can save lives. Again, I welcome you to Monroe County for this important hearing, and thank you to the Communication and Technology Committee for continuing your efforts to bring broadband technology to every corner of Pennsylvania, especially when it comes to improving public safety in our communities. Thank you.
Thank you, Senator Scavello. If the members of the committee would like to take a moment to introduce themselves, I'd really appreciate it.
My name is Scott Hutchinson. I'm the state senator for the 21st Senatorial District, which is at the other end of Interstate 80, almost to the Ohio border, but I'm pleased to be here today. And a very rural district, but and so these kinds of issues are extremely important to me, and I thank the chairwoman for hosting this, as well as Senator Scavello, who's been very active in this issue also. Thank you.
Good afternoon. I'm State Senator Lisa Baker from the 20th Senatorial District, which includes Luzerne, Wyoming, Susquehanna, Wayne, and Pike counties, just to the north of Monroe. I'd like to welcome the chair here and want to thank you for putting a spotlight on an issue that is really something that our small and rural counties have been facing, and the idea that you are addressing it through telehealth and looking at access to quality care is very important. I don't go anywhere in the district where I don't hear some worry, frustration, angst about lack of access to services. And I can relate a story. About a year ago, we had a hearing over in the Northern Tier, and a presenter spoke about his daughter, and she had to be linked up to her hospital healthcare provider because of a fragile medical condition. And because their rural community didn't have access, she and her family had to move to get that access. And so when we think about life safety and health and quality of life, it's really important, and I'm looking forward to this conversation and want to thank you for showcasing it today.
Thank you, Senator Baker. Senator Hutchinson. I would also like to express a warm welcome from my Democratic chair, Senator Steve Sanacero. Unfortunately, he had an unexpected issue arise. He is well, but sends his regrets, and I'm certain we'll be following up with testimony and what was learned here today. So again, he sends his regrets and thanks you all for being here. If we could, I'd like to kick things off with our first panel. Joining us today are Chairwoman Gladys Brown-Dutrell from the Public Utility Commission, Craig Ecker, President and CEO of Tri-County Rural Electric Cooperative, and Kevin Delicker, President and owner of Delicker Strategies. Good afternoon. Chairwoman Dutrell, if you could start us off, we'd really appreciate it.
Good afternoon. It truly is a pleasure to be here. My greetings to the chair. We came in together, and also to Senator Scavello, Senator Hutchinson, and Senator Baker. It's an honor to be here before the Senate Communications and Technology Committee. The importance of that is when I served in the Senate as legal counsel for the Senate Democratic Caucus, this was one of my many committees that I provided legal advice to, and there was a time when it was called the Communications and High Technology Committee. That was changed before I left. I have given you a full copy of my testimony, and we know that Commissioner Kennard also testified before you in the previous weeks. We are building upon his testimony. He has a lot of expertise in this area. So I'm really going to summarize mine. I know we have a panel of 3.
And we thank you for that, because this is
It's
incredible
very detailed.
information. But yes, a summary would be
Yes.
greatly appreciated.
We like to serve as a resource to give you all the information that we've been able to tap into and that may be helpful to you. So as I summarize my testimony, Chapter 30 addressed broadband to health facilities, but our speeds have been overtaken by technology, as we can see that now, as well as the consumer expectation. Universal service mandate that is in Section 254 of the federal law requires that there be comparable rates for comparable services in both urban and rural areas. This includes rural health, which is what we are talking about today. If we talk about broadband, which is the buzzword for not only this hearing, but generally, we know that there are 2 challenges. Challenges being availability, whether the facilities are available, and affordability. That's still very key as well. Rural Pennsylvania faces the broad challenge of availability, and affordability would also be part of that. But rural and urban areas both face the affordability challenge, which the FCC back in 2016 said is the main barrier to broadband adoption. If we think about the federal agencies that support this issue of providing broadband services for rural health, the FCC and the United States Department of Agricultural Rural Utility Services are the main 2. Focusing on the FCC programs that they have, there are 4 of them. They exist to meet the universal service mandate of comparable rates for comparable service that I noted before. So those programs are, the first one is the high cost for rural carriers. The second one is E-rate to support schools and libraries to get broadband to them. The Lifeline program, which we hear about a lot, which helps low-income consumers buy service with a $9.25 monthly support. And then the last one is the rural health care, which is the focus of today. So if you think about also, when you talk about affordability and availability, we know that the cost, the main thing is in terms of the cost to build out this. So the FCC in their rural health care program has 2 funds that I will focus on today and provide you information. The first is the Healthcare Connect Fund, which provides a 65% discount on broadband connections to providers and encourages state and regional networks. The second one is the telecommunications program, which provides discounts on the rates paid for rural telehealth by providers compared to urban telehealth using an urban-rural rate comparison formula. So Pennsylvania providers received a total of $4.4 million of that funding in 2016, and in 2017 they received $2.1 million. We are set to receive about $3.7 million for 2018, and I did provide a list of the recipients in my testimony. Since we are in Monroe County, I wanted to make sure I brought some specifics about Monroe County providers, and they were allocated about $171,234 from 2014 to 2018 from the FCC to support rural telehealth. Of that 171,000, providers received about 153,000 due in part to funding from 2018 and 2019, which is still in process. In 2018, Monroe County providers were allocated about $43,000 and received about $25,000 to date. East Stroudsburg providers were allocated and received about $14,000 in support from the FCC between 2014 and 2015. The second program, or the second agency that I talked about, was the USDA, and their fund has a traditional program and is a new Reconnect program. It's called RUS, which is the Rural utility service and is funded by the federal budget in general, unlike the FCC, which imposes assessments on telecommunication revenues that are ultimately paid for by the consumers. So part of that traditional program is the Distance Learning Technology Program, which gives grants to healthcare providers for healthcare using the internet. Pennsylvania providers got about $2.067 million in 2018 compared to zero that they received in 2016. And a list of providers have also been provided. But it depends on the providers effectively using the application and the timing process, so we emphasize that information as well. The second program is the Reconnect program. This is the newest of the programs, and we'll distribute about $600 million in grants and loans on an expedited basis to deploy broadband in rural areas. Now, this is the newest program, and it was just most recently funded by the federal government through their budget process, so there has not been any distribution of the funds of yet. So I wanted to focus on that, focus on the fact that the PUC is available to help continue this conversation and this process and discussion. You know what the statute was, not only in 1993, but in 2004, and our limitations in terms of broadband. It's not something that we regulate. It's something that we've put in place in terms of what the statute requires and how people can have access to it. So we deal with the challenges or concerns that people may have that they've asked for broadband and it was available, but it has not been deployed to their house within a certain number of days that has been spelled out in the statute. But we are here to serve as a resource and continue to serve or discuss these issues with you as a General Assembly to provide any way that we can bring more broadband to these areas. So I'm available for any questions.
Thank you. Appreciate that very much. Mr. Ecker, if you could, your remarks are succinct, but if you could summarize, we'd appreciate that as
Okay.
well. Thank you.
Okay, Senator. Well, first of all, good afternoon, Chairwoman Kristen Phillips-Hill, and thank you to your fellow senators. It's a privilege being here to speak on this topic with you folks. So I'm really glad to be here because yesterday morning I was in Vero Beach, Florida. I have a house on the intercoastal and finally convinced my wife, let's get the heck out of here. And you know, when we talk about 911 service, emergency management, it's amazing what those coastal towns are able to put together. And let me just say, what's critical, and I think we all know this, it's communication, what's critical for all those emergency management services to actually work. So I just want to put a big shout out to those folks down there. They're phenomenal. But my name's Craig Ecker. I'm the President CEO of Tri-County Rural Electric Cooperative. We're a rural electric cooperative. It's owned by its members. It's governed, maybe more importantly, governed by members. And we've been around since 1936. We cover about 5,000 square miles of territory in north central Pennsylvania, primarily the counties of Potter, Tioga, Bradford County. We have some pieces of Lycoming, a little piece of McKean. We actually go up into New York State a little bit. But, you know, for many years we've been hearing from our membership that they have a lack of connectivity. And I'll be the first one to say, I never viewed us as being the catalyst to actually help this situation because we are electric. We also own some natural gas entities under another organization. And, but that became the message that we continue to hear. And again, we are membership driven. So we started taking a look at this. We ran feasibility studies. And let me just say, I have colleagues across the country. There's about 877 rural electric co-ops across the country. About 100 of them are providing broadband service to their membership in one way or another. It's not all fiber. There's some wireless solutions that they have, but the majority are moving toward a fiber solution. And again, it's being driven by their membership. So we did the study, and again, as you can imagine, it's very capital intensive. And we started looking at communication needs. That's the other driver of this too. It's not just the broadband. It's the lack of cellular service in a lot of these rural areas. It's lack of communication. And it's really critical for us on the electric side from a safety issue with our own linemen and our own personnel. So maybe a little selfishly, we looked at it too to help our own self. So We did the feasibility studies. We realized that we couldn't do it without some assistance, and we identified what kind of grant funding we would need, being a not-for-profit. We're a 501c12. And we went out, and I will say we were, luckily, we're very fortunate that the FCC Connect America Fund auction actually happened. We actually, prior to the auction, we're actually assisting some of the folks at the Public Utility Commission, trying to access some of the $140 million that Verizon turned back because they originally had access to that. But we could see that that wasn't going to happen, and we thought we'll just participate in the auction. I will say Commissioner Sweet really worked very diligently along with the other commissioners and Chairwoman Brown. But we participated in the auction. We were fortunate. We secured $33 million in the auction. So now we're building it. It's an amazing project. It kind of feels like maybe what they felt like back in the 30s when they built the rural electrics. The engagement, the relevancy that you feel in those environments. And I look forward to it from, I say, the selfish standpoint, what it's going to mean to the reliability of the electric system. We take a look at, it's a city down in Tennessee we're working with right now, and Chattanooga. Chattanooga embarked on a project like this in 2012. Since then, they've been able to reduce their outage hours per customer on the electric system by 50%. They have the same amount of incidents that they would have had, same amount of outages, but their outage hours that their customers experience every year is 50% less. That's tremendous. That's what this network can also allow us to provide to our membership. And so we're looking at that. We're looking at the effects that it will have on healthcare. We're working with some of the healthcare providers right now. One in particular is UPMC. We're working with education, aging. We're working primarily in Potter County right now because that's where the project will be launched. We just launched a new project with the help of Department of Aging and the Education Council, and it's called Seniors 2, number 2 Seniors. And what the project is taking seniors out of high school and helping them work with seniors to learn how to use iPads, computers, to help them with telemedicine, stay in communication with their children, their grandchildren. And we think in areas that we have, these very rural areas, sometimes the weather's not that great. And they can't get to the doctor, they can't get to the hospital, or maybe their children would like to know what's going on. This is what we think will help. And a lot of these folks, too, are too proud to really ask somebody for help. But we're going to create an environment to where they can come in, work one-on-one. The seniors actually get some credit for it, too, high school credit. We think it's going to be great. We hope it's a success in Potter County. We hope we can replicate this over the next few counties. I will say this. The broadband build-out, even for the co-ops across the country, it's a very capital-intensive build-out. And I think as we move forward, we need a public-private partnership. The co-ops themselves are private, but the public partnership helps. And it's not always just grant money, too. There may be other options on the table that can help with this. And we've been working with our statewide association on trying to identify some of these other areas that may make it more feasible for the co-ops to be able to provide this kind of service. Like I said, I don't think we're it's an anomaly that we as Tri-County Rural Electric Co-op that are providing this. Yes, we are the first in the state, but there are many more across the country that are doing this. I guess, Chairwoman, I'd like to close my remarks with that, and I'd be happy to answer any questions that the committee would have. Thank you.
Thank you. Mr. Deliker.
Thank you, Senator Phillips-Hill, members of Senate. Senator Scavello, thank you for hosting. I've twice appeared before this committee on the same subject, and it's good to be back again. I don't represent any kind of organization except my own business, so I guess in a sense that makes me an independent subject matter expert, but I certainly have experience working in the broadband field. I've been doing it for about 20 years, first as a technology policy advisor to Governor Tom Ridge. Then I worked for a small firm in Harrisburg doing technology projects, and since 2005 I've had my own business. And one of our core competencies is helping organizations upgrade their advanced telecom capacity, including their broadband capacity. And we've been very busy over the past 14 years. We've worked with more than 2,000 different organizations in about 5 different states, and we've helped to negotiate more than $260 million in upgraded broadband contracts over the years. It interests me because it's my business, it's important to where I live and work, but it also fascinates me from a policy point of view because there's so many contradictions that I see with broadband policy. The core problems are very, very simple, yet it seems that a lot of the solutions that we wrestle with seems to be extremely complex. And another observation is that it appears that a lot of times policymakers keep looking for new and unique solutions to the problem when perhaps it's right before our very eyes. I think one of the main issues is the core problem of telecom economics. And if we don't address that issue first and foremost, then I think any kind of proposal that we put in place is going to be doomed to fail. What I mean by that is really very simple. It costs more to serve people in rural areas than it does in urban areas. And it's simply a matter of fact that if you stretch out a piece of fiber in the city, you can hit a lot of customers, and in the rural areas, you can only hit very few. So your return on investment is much, much lower, the lower the population, and that's what we're dealing with. And there's all kinds of solutions that are being proposed that sort of skirt around that main issue. And in fact, unless we focus on that main problem, I think we're doomed to fail no matter what we try. One of the top so-called solutions that I see proposed, and honestly I've watched it battered around for almost 2 decades, are these ideas of public benefit broadband projects. They have all sorts of different names, but they're characterized by 2 things. Very, very extensive government involvement in the operations of telecom networks, and oftentimes actual government ownership or direct subsidies of these networks themselves. Quite frankly, I'm not aware of any of these types of projects across Pennsylvania that have met expectations, and there's very few around the country that I'm aware of that have really delivered on what they've promised. These projects tend to be based on this very tantalizing, but I think very misguided notion that new public nonprofits can do a better job of delivering broadband access to underserved areas than established private companies that know the telecom business. Often, this derives from a reactionary viewpoint that the private providers are some kind of enemy to the communities in which they operate. But if experienced telecom providers can't deliver services despite the profit motive, inexperienced public officials are unlikely to do better out of the goodness of their hearts or the goading of their political bosses. This idea of public benefit broadband has a lot of traction in Pennsylvania, and it has for many, many years, despite the lack of successful examples. Sometimes these initiatives are packaged with questionable financing schemes that make it seem like if you do this, you'll get your network for free. They're not free, and they're not very effective. And I think setting up bureaucrats to run telecom networks when they don't really know how to do it, especially when it fails to address the underlying problem, means that these efforts are almost always going to fail. Another thing that I see tried a lot is this notion of subsidizing telecom providers directly, especially when that comes from taxpayer money. Often we see programs that grant millions and millions of dollars to private telecom companies to build new networks that these companies are going to now own and operate themselves. Generally, giving taxpayer money to private companies so that they can earn profits is a bad idea. And that's why it gets these derogatory names like corporate welfare. But it seems that in the telecom space, we don't seem to view it the same way, and giving public money to telecom companies, often to undercut their privately funded rivals, seems to happen quite often. Especially in today's market, private financial markets provide ample opportunities for entrepreneurial companies to build their own broadband networks. They don't need public handouts. Government programs that give grants directly to telecom companies often create negative market distortions, rarely help the most qualified providers deliver service, and often promote companies that consumers don't want to buy from in the first place. These programs also should be avoided. There's a better way, and it's using the market in a process called demand aggregation. It's sometimes been described as the Walmart approach to buying telecom. It's really a very simple concept, and it has a very successful track record, and it works by focusing on that core problem of telecom economics. The way demand aggregation works is you organize multiple buyers, preferably large enterprise buyers, into a purchasing consortium. And then you issue a competitive procurement so that the best vendor earns the business from that group of buyers. When you do that, a regional vendor who otherwise wouldn't necessarily be able to build capital investments to all those individual organizations now has a group of buyers and can target that investment much more cost effectively. So instead of a speculative build, now you're doing a targeted build based on actual demand. Essentially, you turn the buyers from price takers into market makers, and they're moving the market themselves through their aggregation project. It works. In fact, it works almost every time it's tried. My company personally has overseen 75 projects like this over the past 14 years, and every single one of them achieved the goal of faster service for a lower price. We do these in urban areas, we do these in rural areas, we do them in Pennsylvania, we do them in New Jersey, and in other states. My most recent effort was 700 public organizations in New Jersey that were able to increase their internet bandwidth by 155% while reducing their costs by 58%. This is the power of working together and giving the consumers their buying power. All these services are delivered by reputable private companies without any public subsidies. We've done similar projects in Pennsylvania, even in some of the hardest to serve areas. Last year, we did 14 school districts expand their internet access to 869 megabits per second on average, so just about a gig, while reducing their cost by $162,000 in the aggregate. I can tell you that those schools are paying less than the average price of those New Jersey projects, and those school districts were in Potter, McCain, Elk, and Cameron counties. So if we can do an aggregation project in a place like that in Pennsylvania, we can be successful anywhere. In fact, I think in every single district that you represent, we've done projects doing this very thing, using some sort of anchored tenant to be able to drive those prices lower. If the state does want to provide some sort of extra funding to accelerate adoption of broadband services, there's two successful programs that I think you ought to consider and perhaps emulate. The first one is called the Broadband Outreach and Aggregation Fund, and the other one is called the E-Fund. These programs were authorized by Act 183 of 2004. They haven't existed for many, many years, but they were extraordinarily successful. The first fund, the Broadband Outreach and Aggregation Fund, was administered by the Department of Community and Economic Development, and it was capitalized with about $5 million. And it basically helped communities organize their own demand aggregation projects. We did a number of these projects, and we helped organizations as diverse as coal mines to banks to hospitals to school districts to colleges. And it was really a matter of trying to generate that demand that we could then present to the regional telecom providers to be able to bid on and compete for the business. The E-Fund was focused on the K-12 educational space, and that took that concept a step further. It allocated $60 million to the winners of school broadband aggregation projects. The districts or the intermediate units would lead those projects and organize the schools. They would issue the competitive procurements in accordance with the E-rate process, and they would select the vendors. And after the vendors were selected, that fund was used to help build out the additional infrastructure that not only helped the school districts, but it also helped the other organizations be able to turn on and access new services that otherwise wouldn't exist. I remember doing the projects in the Scranton-Wilkes-Barre area, and after we did the schools, all of a sudden, now the hospitals could buy that high-speed service that didn't exist previously, because by that aggregation of demand in that enterprise district project, we were able to drive that infrastructure build-out across the entire community. That program was so successful, it was used by 621 school districts and other nonprofit and private organizations in Pennsylvania, and their aggregate numbers were a 224% increase in their bandwidth for 25% less cost. So these projects work. Notably, neither the E-Fund nor that Broadband Outreach and Aggregation Fund were financed with a single dime of taxpayer money. They were part of a negotiated solution from Act 183 that delivered regulatory relief to the providers in exchange for the capitalization of these funds. Another win-win-win scenario. So my final point is that with strong local leadership, significant community participation, and meaningful vendor engagement, these types of market-driven approaches like demand aggregation work every time. So as you consider your alternative policies and programs, I urge you to take a look at these tried and true programs instead of some of these other things that don't have the track record as you go and develop new policy. Thank you very much for allowing me to testify today.
Thank you very much. Appreciate the start things off with a question. As I had referenced in opening remarks, the recent Pennsylvania State University study was conducted, said there are 11 million people across the Commonwealth who are without access to high-speed internet. High-speed internet as defined by the Federal Communications Commission 25.3. The maps that we have here in Pennsylvania said it was about 800,000. What I have heard in previous testimony before this committee and in talking with other individuals is that there are regulatory barriers to bringing high-speed internet access to the Commonwealth. Mr. Eckert, you touched on it very briefly in your testimony, but didn't expand on it. So if you could, can you help identify what some of those regulatory barriers are? And I would say also to Mr. Delaker, if you could share any of those barriers that you faced when you were attempting to do this demand aggregation, I think it would be really helpful for us, and certainly Chairwoman Dutrell, I know you have looked at a lot of these challenges as well. So if you could sort of lay out for us what some of those regulatory barriers are, I would really appreciate it.
I would like to do that, Senator. First of all, I just want to say thank you to Chairwoman, only because one of the regulatory barriers you helped us through, we received our eligible telecommunications carrier status. So we are a provider of last resort on the phone side in the census blocks that we're serving. I think where you're driving on us and where we were driving on is on the maps themselves, how the granularity just isn't there. And we began to find this out when we participated in the Connect America Fund auction, which was driven by census block groups. That's what you were bidding on. I really probably would have rather had them by census blocks, but that would become probably a manageable issue, more of a struggle to manage. Because if you take a census block group, you might have one block that might have 10-1, maybe. And that would all of a sudden become ineligible as a census block group. So it would be viewed as that area was served when it really isn't. And I think there's some other challenges on the regulatory side on what's defined as broadband and what isn't. We saw that in the auction with some providers bidding and securing census block groups around us using a different technology that might have issues on the phone side from a latency issue. So, but we'll see where that goes. I think the FCC is going to be dealing with that issue as we move forward. But I think the granularity of the maps is a real issue, Senator, for us as we look at what other areas we want to serve, and especially as the FCC deems them being served when in fact they are not. So that's some of the challenges that we're addressing in the testimony.
We're hoping to have the Federal Communications Commission testify in September in Harrisburg, and certainly I have heard some things. I serve on the Intergovernmental Advisory Committee to the FCC, that they are looking at redoing their maps. So certainly from your point of view, making investments, you want to know where that broadband actually is and actually isn't. You don't want to overlay where service is already provided.
Yeah, we have no intention of overbuilding good service. Now, it depends what you consider good service. 10-1 is not adequate service in this day and age. Those are areas that we probably will overbuild, but there are a lot of areas that are defined as being served by the FCC maps when in fact that's all they have, if that at all. So,
I appreciate that. Your investment will only be as good as the data behind it.
Correct.
So, thank you.
So I think we spent too much money and time on maps over the past 20 years. And here's why. when you get a map that shows that fiber runs by a particular location, that fiber may or may not be available or accessible to the people that actually need it in that community. And if you have a consumer that wants to buy broadband service and is willing to pay market prices for it, then whether or not that fiber actually runs by them, they're a good target for an investment so that they can have a paying customer. I think maps tend to be a distraction on the real issue, which is consumer demand and how do we get that infrastructure out to the particular consumers. I don't see upgrading maps as a critical piece to the puzzle in broadband. I'm far more concerned about who the consumers are and how much they're spending on their broadband access and how much they want to buy. One of the killers of a demand aggregation project, which I run into time and time again in rural communities, is the communities complain that they don't have enough broadband access, but they don't want to spend money on getting fiber into their communities at market prices. They have an unrealistic view of what fiber and telecom actually costs. And when we lay out the costs and show them what this actually goes for in market prices in other areas, they're often very, very surprised, and they want to get high-speed service on the cheap. Well, there's a cost to delivering high-speed service, and a lot of that has to do with educating the consumer, not just on what market prices really are, but what you can do with this type of broadband service, that once you have it, and how you can use that to impact your business.
I just will chime in a little bit here. As you probably have already heard in terms of what the PUC has been saying for the last couple of years, that our barrier is that we are the agency that implements the Act or Chapter 30, which is Act 183, has a speed that is DSL speed, which is the, 25, not 25 down, it's 0.128 megabits down and 1.5 up. If we're talking about that type of speed, we're talking about Netflix speed is the 25 down and 3 up. So we're way beyond that in terms of DSL. I'm not even sure anyone uses DSL. Well, there are areas that do use DSL, so I do apologize for that. We're even talking about the city of Harrisburg, where all of you serve, only has access to DSL when it comes to certain providers. I had one of those homes, and that's why I can say that. But when you go to other providers, of course, they can have higher speeds. So our limitation as regulators is that we can only say what's in the statute. That was something that would have to be changed, but it doesn't necessarily solve all the other problems that comes from making a higher speed, and that would be the cost of the build out. One of the things that, as part of our discussion, as part of our deliberation as an agency, we also have been looking into regulations, which we are in the final stage in terms of pole attachments, which could really help in terms of the rollout of the 5G that we're talking about moving into in terms of different areas within the state. So we are in the final stage of those regulations. They are now going over to the Independent Regulatory Review Commission. But a continued conversation on these type of issues, I believe working together to try to discuss all of this is helping move the ball forward in terms of providing more access.
Thank you very much. Senator Baker.
Thank you. Chairwoman, I was going to ask you about the pole attachment regulation. So it has moved to the Independent Regulatory Review Commission. I mean, that is something I hear of frequently here, whether it's a provider who would like to utilize an existing pole, but the barriers to do that are very high. What have you looked at in that regard, and how do you see that as being a fix toward the future?
So our regulations deal with taking over the current jurisdiction from the FCC, which is permitted, and we would be the agency that different companies would be able to come to in terms of asking for permission to use certain poles for different things. And we believe with that, it would be a quicker process, hopefully a more streamlined process as we work through all of it. But it is in the final regulatory stage. When I say final, we just passed it at our public meeting last Thursday. So it has to go before the Independent Regulatory Review Commission. We did have a lot of different comments that were submitted and tried to address all those concerns, and hopefully working through that process will be something that would be beneficial.
I do hear that frequently, and Mr. Delicker, you talked a lot about market share and demand aggregation. I can tell you that there are parts of this state that think that sounds really great, but they just don't see any interest or a lack of responsiveness. And whether you travel throughout my part of the district, I can tell you I call drop, I have no data access. It's amazing in this day and age that those pockets exist. And if you're a family with kids in school or healthcare, a couple of our Pike County doesn't even have a hospital. So we're struggling to deal with that. So how do we take that initiative and turn that lack of what people believe is responsiveness and no interest in serving them into a win-win for our constituents and a market solution, as you described?
I'm not denying that there aren't pockets, and really, really big pockets of poor coverage or no coverage in different parts of Pennsylvania, and working in places like Sullivan County and Susquehanna County and Wayne County and Pike County and some of those places up there. Absolutely, you have hard to serve areas. I guess, though, my fundamental observation is that if it doesn't work with private companies, then it's probably not going to work with some of these other solutions unless we look at the core issue of how do we close that gap between the supply and the demand. I think one thing for the committee to really consider going forward is that any solution that focuses on trying to get cable modems and DSL anywhere at this point in time is probably last decade's problem. Our issue now is 5G. And if we thought we had a problem with cable modems and DSL in rural areas, wait till 5G starts lighting up the cities and the rural areas are even further behind. Communities have to get organized and they have to get educated on the problems and what the real answers to these questions are, and understand how this works and make real investments in their communities, because otherwise I'm afraid that that digital divide that already exists is just going to get worse and worse if we don't start planning for these future technologies and the fiber rollouts instead of worrying too much about DSL.
And obviously, as we're losing landlines and relying so much more on wireless networks, do we still need Pennsylvania Universal Service Fund? Should we preserve that? How do we ensure that some of those areas that have relied on that funding, my smaller communities, that is their lifeline? How do we bridge the gap to get where we're in a technology choice, a technology neutral space, but doing it in a way that we're not harming those parts of the state that have relied on that so significantly?
Senator, I wish I knew the answer to that question, and you're now getting outside my area of policy expertise. What I wish in communities is that when we walked in and talked about the broadband problem, that we could get the school and the hospital and the local government and the business to sit down at the same table and start working on it together. Because if we can get those enterprise buyers to look at this as a community initiative altogether instead of as separate industry segments and separate organizations, then we're going to have a much better chance of solving that problem. Thank you.
Thank you, Senator Baker. Senator Hutchinson.
Thank you. Two different lines that I wanted to ask about, if I can be accommodated. Thank you. Mr. Ecker, you had a dollar figure in here. You said you've received or will be receiving $32.5 million over the next 10 years. But then you put in there, however, the total cost of this project is many millions more. And I guess the two parts of that question I have is, number one, ballpark. How many millions more do you think it will take? But number two, you also mentioned that many of your sister co-ops around the country have already been in the broadband business for a while, and I'm wondering how they were able to pay for their build out.
The answer to the first question, it's about an $80 million build. So. Again, it's interesting because I think co-ops themselves are a good example of aggregation. I mean, we did that with electricity. If it wasn't for the co-ops, our counties and many areas wouldn't have electricity right now because of the same issue, the cost of the build, the infrastructure cost. And so the rural electrics, the communities came together and created a co-op, and now we serve ourselves, basically. That's how we run that. And so that's what we're going to do with the broadband. It's about an $80 million build. The rest of it comes from some other grants that we're working on. It comes from internal financing, and it comes from the cash flow generated from the enterprise. So that's how we make this thing work. It's about a 6-year build. I think it will continue to build because of the need, but the initial build is 6 years. And we will probably have about between 2,800 and 3,000 miles of fiber we will run. But again, like I said, a lot of the membership looks at this as what happened back in the 30s. Because when you try to get to every individual customer, not an anchor, not a large business, but I mean a residential customer, there's no profit in it. That's the issue. And to get it to the price to where you could drive some profit, you're really going to be putting those rural areas economically at a disadvantage. One of the things that we saw too, again from Chattanooga, they put a $250 million build, and 4 years later, they had an economic return of about $800 million. So, there's a huge economic incentive for areas to do this. But again, I mean, I echo the sentiment that it's highly capital intensive, it's a costly build. And, and you just can't do it with all grant money. I agree with that 100%. But somehow it's got to work. And we're just looking at it from the fact, we did this back in the 30s. Let's start this aggregation all over again. So.
Thank you. Mr. Delacour, just a maybe a funny question, but I'm serious to wonder, using your model of individual companies like yours that aggregates customers and gets service to them, how do we replicate that? How do we get others to be in that business? Are there many in that business already? For that model to work, we'll need lots of Delacour strategies and/or similar groups. So tell me about that.
The Broadband Outreach and Aggregation Fund helped to finance some of that work years ago. I think when we started to do projects like that, we realized there was a market for it with or without grant financing, but that depends upon community leadership. So, for example, in Monroe County, we did a project here just a couple of years ago, and there was no grant involved with it. It was just a bunch of organizations that had a need, and we were able to aggregate their demand, put it out to bid, and then like magic, you see providers come in and they react to the competition and they build out, and we got more service for a better price. I don't want to oversimplify it, and I don't want to make it seem like it's the be-all, end-all solution, but it is one of the solutions that does focus on the core economic problem without plowing millions and millions of dollars into providers under this, cliche of if we build it, they will come. We should stop doing that. If there's going to be subsidies, put them in the hands of the consumers and let them go and see who's going to compete and win the business instead of financing build-outs in places we don't know where there's fiber already, because we don't have a great map, and we're going to build it on top of, some other institution that, might already be there. And to me, the thing that is the absolute most horrible thing that we can do is give money to a private telecom company who now goes and overbuilds in a place where another private company has already spent their own money to go build. Because now you have some subsidized firm coming in there and undercutting them and messing up all their models. And we see that happen time and time again. That broadband stimulus bill that happened 10 years ago from the federal government financed those types of projects all over the state. And you get things like that $99 million Kinber boondoggle that we're still dealing with in Pennsylvania. It's bad policy, and that's what I urge you, not to do.
Thank you.
Thank you, Senator Hutchinson. I would like to recognize Representative Rosemary Brown has joined us. Thank you, Representative. Senator Scavello.
Mr. Delacour, I just want to follow up because listening to your testimony, I thought it was negotiating a gas line or a sewer line, a sanitary line. Let me tell you why. You need big users to make it happen, and that's what you were talking about, even with telecom, assuming. we're bringing a gas line down 611, and if I didn't have some big users, I couldn't, and then it's available to all, it doesn't work. And I guess in your business, it does as well. Just one question. I hope I'm not throwing a curveball, because I'm getting a lot of emails. I don't know if the other senators or House members are getting it, but protect me from 5G. Have you heard of these emails? Have you heard of? They're out there. People think that it's gonna. I don't know, but I must have about 25 emails in the last couple of weeks.
I mean, 5G, I think the reason why people are concerned about it is because it's new. And instead of having towers on the top of very, very tall poles far, far away from people, now all of a sudden you have many more towers set up all throughout a more densely populated area. And people are concerned about, you know, what happens when you deploy that type of technology and the radiation involved when they read reports about radiation from cell phones. And I think we have to be careful not to dismiss it, but we also have to be careful not to, you know, get too scared by it and worry too much as we go and evaluate these things based on the facts. Would I want to have one in my yard? Maybe not, you know, but is that just me being reactive? Perhaps. You know, I think that 5G, there needs to be a balance between rolling it out and making sure that we don't have so many hurdles, local government by local government, that, you know, you make it nearly impossible to roll out this very important technology. But on the other hand, I think it's also dangerous to just say that the telecom companies can put these towers wherever they want without any sort of local involvement. There needs to be some sort of a balance.
Thank you very much.
Thank you, Senator Scavello. Thank you to all the folks who've testified on our first panel. Really appreciate you being here today, and
Thank you.
it really helps us as we work through this process. So I would like to move on to our second panel. And joining us today for this part of our discussion are Brian Barno, Vice President of the Broadband Cable Association of Pennsylvania, Joe Laura, Corporate Director of Marketing and Customer Services for Blue Ridge Communications, and Dave Kerr, President of External Affairs for AT&T Pennsylvania. So gentlemen, thank you. And again, I would ask that you please summarize your opening remarks as much as possible. Thank you.
Joe start, if that's okay.
Joe most certainly can start.
Hello, everybody. Thank you for having me here today. My name is Joe Laura. I'm from Blue Ridge Communications. And as much as I love to talk, I understand we're already running late, so I'll try to summarize as much as possible my presentation here. A little bit about Blue Ridge first. We started back in 1950 when our founder ran cable from a mountaintop down to Palmerton. As the story goes, it's kind of like Babe Ruth. He pointed to the mountain and said, I'm going to put an antenna up there. And he did. And he ran the wire down, hooked up a local community hall in Palmerton. And for the first time, the residents of Palmerton were able to see broadcast stations from Philadelphia. Boom, right? That's 1950. Fast forward, 1994, Blue Ridge parent company Pencor Services founded Penn Teledata. And their intent was providing affordable broadband internet to all the communities. Penn Teledata is a strategic partnership of local communication companies that serves 28 counties in eastern Pennsylvania and western New Jersey. Today, Penn Teledata is one of the largest privately owned networks in the nation and has deployed nearly 10,000 miles of fiber optic cabling. Penn Teledata's network connects a number of notable customers, including Lehigh Valley Health Network, Crayola, Wise Markets, and of course the building we're sitting in now, this 911 center, is connected by Penn Teledata. Blue Ridge and Penn Teledata plan to continue to invest each year to meet the ever-growing demands of our subscribers for high-speed internet access and other IP services. Blue Ridge has been using private funds to build out our unserved areas and has been investing in existing networks to bring customers the fast internet speeds they demand. Private investors across the country have been investing vast amounts of money in infrastructure. In fact, the American Cable Association estimates that broadband providers are investing $75 billion annually. By the beginning of 2018, Blue Ridge has deployed 1 gig speeds through its entire footprint, including the Poconos. That's something, when I kind of hear about availability of fast speeds, I'm like, not Blue Ridge, because Blue Ridge, we start at 25 speed for our customers, and it's like I said, through our entire footprint. So everywhere we serve, it's at least 25, and everyone has at least has a gig. So we're very on top of deploying the fastest internet speeds around. Blue Ridge added 22.62 miles of new cable plant and 34.5 miles of new fiber optics using our private funds. For 2019, we're projected to match that. The best way to ensure providers like us to continue to make these investments is to do no harm, and nothing will undermine Blue Ridge and Penn Teledata's efforts to deploy broadband more than signaling to us that our returns on investment are uncertain or even in jeopardy. The best way to ensure that private investors continue to invest is to ensure that governmental efforts do no harm. In other words, do not permit governmental support to be used in areas where private investment has already been used to deploy infrastructure. Duplicate effort by overbuilders are a waste of taxpayer funds. Public funds should not be used for middle mile builds. We already have that. Last mile is what rural communities need. Ask any provider what stands in the way of fast deployment, and you'll hear 2 things: cost and pole attachments. Deployment is extremely costly, especially in areas where there's not enough homes per mile to generate enough income to justify a costly build. The speed of deployment depends on how many hoops a provider must continue to jump through. There are many barriers to construction, each with its own challenges and associated fees. These barriers include assessing poles, duct conduits, right-of-ways, delayed applications, costly make-ready, among other things. Pole attachments are governed by a mix of federal, state, and local requirements, which further complicate deployment. Deploying broadband is no easy matter. It takes immense amount of cooperation among providers, federal, state, and local governments. Blue Ridge and Penn Teledata are ready to connect all we can, but we need your assistance and cooperation. Together, we can work to expand and improve access to high-speed internet as long as private investment is given the opportunity to thrive and barriers to deployment are broken down. Is that a quick enough summary?
That was fantastic.
Thank you.
Thank you very much. Brian Barno.
Thanks, Madam Chair. Thank you. Is this on? It's great to be here today. I appreciate the opportunity, Madam Chair, host, Senator Scavello, members of the committee. It's also great to be here with Joe Lohr from Blue Ridge. Blue Ridge is one of our leading telecommunications providers in the state, long-term BCAT member, founder in the industry, and doing great work through the Poconos, Northern Tier, Lancaster County, Central Pennsylvania. So it's although a company's been around for 50 plus years, it's really a cutting edge, innovative company that's one of the national models for things that they do. So we're real proud to have them here and representing BCAP today. Broadband, as you all know, is a critical infrastructure. It's a game changer. To fully engage in the community, to fully engage as a student, as a parent, as an educator, you need to have broadband. And I appreciate the Madam Chair's efforts to first off identify where we have broadband now, and then where do we go from here? What's the next step in the process? One of the concerns we have with the Center for Rural Pennsylvania study, which I detailed in my report, is that speed testing has some limited value. If you've got an individual who has chosen not to purchase broadband, will report one thing on a speed test. You may have, like, for example, if Blue Ridge was outside my house, I can get 1 gig service downstream, but I don't sign on for Blue Ridge. I'm not going to report any broadband speed at all. Or if I get a 25.3 or 10.1 service rather than the higher speed service, my report that I'll make on the speed test will be significantly lower. So we've got some significant concerns with that study. Mapping is important. Mapping is really critical. While the Connect America Fund 2 mapping process was not great, it led to identify thousands of areas in the state that were unserved census blocks. One of the priorities of the CAF2 program is that it looked at qualified providers. The qualified providers bid on certain census blocks. PennDOT came up with $35 million in addition to that to make available. So providers like Armstrong, which is a BCAP member based out of Butler, Pennsylvania, is building fiber to the home projects in eastern Erie, Mercer, and Crawford County. Tri-County Rural Electric, Mr. Ecker was here earlier, is doing a build there. So it's just a great example of using federal funds to spur qualified private investors to go out and build plant. On the ground, demand aggregation was mentioned a little bit earlier. We're seeing that here in Monroe County. We work with Blue Ridge Communications, and work with Senator Scavello's staff, Representative Madden's staff, on an area up in Pike Township and surrounding areas that needed broadband. Individuals came together, signed a petition, been in contact with the Office of Broadband Initiatives in Harrisburg and with Blue Ridge, and Blue Ridge just stepped up and said, listen, we're going to do the engineering studies, we'll do the specs on this thing, and they're in the process now of applying for pole attachments to dramatically expand broadband in that part of the county. So we're excited about that. So the idea of bringing people together, businesses, community, education community, together to push expanded advanced broadband is a positive. Talk about innovation. We need to be innovative. We've got X amount of broadband out there right now. How do we go to do the next step and expand broadband to the folks that don't have access to it now? One we've seen in German Township out in Fayette County, the township is using their cable franchise fees to incent the local cable provider, Atlantic Broadband, to expand the broadband plant. They've done that for 5 years right now. It's been a very effective way to move out broadband. So if our guys are going down to 10 or 12 or 15 homes per mile, how do we get to a point that they're going down to 7 homes a mile or 5 homes a mile? How do we find a way to get that additional economic incentive to be able to push that broadband plant further out? It's not economical to run fiber to every home. There's a home that's 5 miles or 2 miles down the road. Putting a fiber run directly to that home may not make economic sense. But I spoke with Michael Hain, one of our members from Nittany Media in Juniata County. Michael is looking at putting fiber right to the pole, right to the top of the silo, shooting a fixed wireless signal across the valley to hook up a small community of a handful of homes with broadband connectivity. So there's some innovative ways to use broadband. And again, the priority is look at providers out there that are in the business and know what they're doing to be able to go forward and do that. Finally, let me mention there's a piece of legislation that Senator Langerholk from Cambria County has a bill, Senate Bill 835, which talks about funding broadband in Pennsylvania. And he looks at funding broadband for qualified providers, phone companies, cable operators, rural electric companies, fixed wireless companies, companies that have been in business for a while, folks that have a track record of working with customers, folks that have the financial, managerial, and technical wherewithal to build broadband plant. And it's not just building it. Mr. Delacour mentioned earlier governmental entities out there that can build. We can find a contractor to come out and build the plant. The issue is not only building it, but maintaining it, upgrading it, putting the ongoing reinvestment in plant and equipment to keep the process up and running and satisfy the customers. And it's a highly technical, heavily leveraged, financially demanding environment to be in. And we need to look at providers that know what they're doing, have a track record of success as we're looking at spurring and incenting investment in the state. One of the things about Senator Langerholk's bill, which is pretty fascinating, which is he wants the individual providers to have skin in the game. He's requiring a minimum of 25% investment from the entity building the broadband to contribute to the project. So it's not going to be a local township or municipality getting federal funds or USDA funds or other funds to build the project. It'll be a provider with investment in the community with skin in the game, that they're going to be there in the long haul and the short haul to deliver services to the community. So we're looking forward to, again, further discussion about that legislation going forward. So again, we appreciate the opportunity to be here. We look forward to working with the committee going forward.
Thank you very much. Mr. Kerr.
Thank you very much, Chairwoman, members. Let me just begin by summarizing and outlining who AT&T is in Pennsylvania and who we are not. I never assume people understand our company. We are the largest incumbent local exchange company in the country, but we are not an ILEC, like Verizon or the Pennsylvania Telephone Association member companies. So we are a CLEC here, a competitive local exchange company, a middle mile fiber provider. We have fiber across the state. We do own DirecTV, yes, but we are not a retail high-speed satellite provider. In other words, a couple companies you're probably familiar with in your rural districts, Viasat or HughesNet. We do not own those. I know there's some confusion out there. Those are separate companies. We are a wireless provider, of course, and as has been mentioned here, we are a large capital investor like others in the industry. We've invested over $775 million in our network the last 3 years, and that includes over 3,300 upgrades on our wireless network. So what is an upgrade? I mean, it's a new tower in rural areas. We've put those up. It's also something called carrier additions, which is basically a fancy term for dealing with capacity, adding capacity to existing cell sites that are out there. And then we've also deployed a number, and this is increasing in our industry, small cells and DAS antennas, small backpack size antennas connected to utility poles. So our experience in the broadband policy is, if constructed right, public-private partnerships can work. We've talked a little bit today about the Connect America Fund program at the FCC. I also would mention FirstNet was a very successful public-private partnership. FirstNet's basically an independent authority created by Congress and housed at the U.S. Department of Commerce. It was the last recommendation as part of the 9/11 Commission, and the FirstNet Authority's goal is to build, operate, and maintain a national public safety broadband network. AT&T won a federal procurement to build and operate that network. And as part of that contract, we worked here in Pennsylvania with the Wolf administration, with the Pennsylvania State Police, and also with the House and Senate, who had a couple oversight committee hearings on that subject. And what we've done as part of that is we've committed to build a number of new cell sites in rural areas here in Pennsylvania nationally, and this is above and beyond what we have outlined in our traditional build plans internally. So it's important to note that these new FirstNet sites and deployment and the spectrum that came as part of it is to serve public safety subscribers first and foremost, but it will also help enhance and expand network coverage for commercial and individual consumers. So it's a good example of a public-private partnership. Let me also mention, because it's in my testimony briefly, a very transformative project that we're involved in, something called Project AirGig. This had its genesis in the AT&T labs, which is back in the Bell Labs back in the day. And it's basically a project that will, we hope, and I think all policymakers hope, will provide multi-gigabit speeds using power lines. So Project AirGig is basically a number of our men and women in the AT&T labs got together, worked with some plastic transmitters that will deliver electromagnetic waves over power lines. This is not the old broadband over power lines that actually used the power lines. This is electromagnetic waves around the power lines. So we've started working with some trials with some utility companies in Georgia and another area of the country, and we think this eventually, it's not in the marketplace yet, but eventually in the next few years would be a potential solution to our rural broadband problem. In 2012, this effort started. It was funded by the company within of these scientists at AT&T Labs, and now we have over 500 patents right now. So it's exciting. It's a ways off, but it's very exciting, and I can provide some more information on that project as well. So why we're here, what can the state do? Again, I think in terms of funding, we had a conversation earlier about adoption. I think if structured correctly, efforts to encourage adoption are critical for you all as a committee to think about. In terms of the Connect America Fund, we agree with many of the other providers here, prioritizing funding to unserved areas, targeting people most likely to otherwise remain unserved is critical. use the competitive bidding process that the FCC through the Connect America Fund has outlined, and making sure that the provider seeks the least amount of funding per location while meeting the minimum performance criteria. So those are all important. I also would argue that you should look at tax policies in the state as part of encouraging broadband build-out. I would compliment the Wolf administration as well on the creation of the Broadband Office. It provides a single point of contact for communities that you represent, but also for the providers, and we've used that from time to time as well. So that really that kind of agency cooperation, agency review. I think the a review and discussing with the agencies what they can do on their permitting timelines, any efforts that are putting a moratorium on build-outs in place really need to be looked at for rural areas. Right-of-way access, too. I mean, the timelines around right-of-way access for us as a wireless provider is an issue. And then also, and lastly, to look at local permitting processes. Certainly the construction and the implementation and building of small cells is different than a tower. So we've got a number of municipalities in Pennsylvania. They should retain their authority over certain areas, but we need to look at streamlining the permitting processes as well to really enhance this technology. So with that, I will stop, and the panel will be happy to answer any questions.
Thank you very much. And I don't even need to ask my regulatory barriers question because you all have very effectively answered it for me. But if I could, Mr. Kerr, you spoke about FirstNet. Representative Pam Snyder has a bill in the House. I have the companion bill in the Senate that would look at inventorying state-owned assets for the further deployment of high-speed internet across the Commonwealth. Concern always being that our state police, our first responders, have the communications that they need. As one of the folks testified earlier, Vero Beach, Florida, when that crisis hits, we want our first responders to be able to do what they need to do to keep a community safe. Could you go into further detail about if we inventory state-owned assets for the further deployment of broadband, what it would mean potentially for utilizing state police towers throughout the state, and how we could possibly do that at the same time protecting essential communications for our first responders, particularly in a crisis?
Sure, absolutely. We worked very closely with the Pennsylvania State Police as part of the FirstNet process. They were designated by the governor as the point of contact for us to work with. I think it's important to note that the whole FirstNet effort is not a replacement for the land mobile radio, the LMR radio project. Those are separate and complementary, so that being first and foremost. We had discussions with the Pennsylvania State Police about their assets, as I'm sure other providers here have on a regular basis. And again, those are available for us as they're available to others to look at. And I know they're testifying today and can probably answer further questions on it. But I think more broadly on state assets, anything that can be provided to look at where the assets are, what they might be. I mean, I know speaking for us, and I know other wireless carriers are always looking, when we get a search ring for a new tower in a rural area, the first thing we look at are existing sites and existing structures. So if those could be inventoried and made more readily available for us to look at, that would be obviously a help.
Thank you very much. I would now like to recognize Senator Scavello.
Thank you again, Madam Chair. Thank you all for your testimony. Brian, you hit on something. I'm going to ask Joe, because I think Joe's putting the infrastructure up in Price Township. You need poles, of course, and the poles are there. You think you're going to run into an issue with using the poles up there? Or?
Well, as of this morning, we ran into a little issue.
Joe, please speak. Thank you.
For us to build and to start building in Price Township. So we engineered it out. Everything's good to go. So the next step was getting the franchise from Price Township. And then we found out through the engineering process, we actually overlapped in the Price Township about, say, I think 50 to 100 customers. So we notify Price Township. We're like, hey, we have these customers. They're in your township. We don't have a franchise agreement. We're looking to add more the development, so we need a franchise. I just heard this morning that they came back and said no franchise. We're trying to figure out the details of why they said no franchise. If it meant we don't need one, just build, or if they said no, we don't want cable in our community. So that's a development that literally just happened on my way out. So that's one of the barriers, applying for a franchise, that your office worked with us to try to get this community. We engineered it. We're like, let's go. And now, the community is now holding up, because the franchise process takes time, because they can only present at their meetings, which are monthly, and then it could go to the next month, so it could delay it. And now we're trying to get the details. So we're hoping it's just a misunderstanding, and we can get in there. But as soon as that's done, it's still going to take some time. I believe we applied for all the permits and everything, so it's just a matter of getting everything else done.
I'll talk to the representative, we'll talk to the supervisor.
Yeah, and I could call your office
Yeah.
when I get back and see if there's any more clarification.
Sure.
Since this morning.
Croucher Road,
Yes,
is it a pole problem there?
that's a right-of-way problem. So there's private property.
The poles are on the private property?
Yes, we have to go through private property, so I'm not sure if it's poles or if we're underground. But there's, I can't remember off the top of my head, 8, 10 maybe residents that we
I know.
haven't been able to get a hold of. I think your office was able to help us to get a hold of some of them,
Yeah.
but some of them we still can't. And they try to engineer different ways to go around, and there's no other way but.
It has to go through
has
that,
to go through
otherwise it's much more of an expense, is that what you're saying?
No, there's no other way to do it unless we
On
go.
the- Even in the shoulders?
No, because then we have to come, because I verified, because I knew you were going to ask, Taylor's going to ask the question, like, there has to be a way. I'm like, so, I go, let me get this clear, there's no other way. And they said, no, because even if they go around it, they still have to come back around it, I guess, to get to a pole. So they said there's no other, he said they even looked out, they double and triple checked just to make sure.
If you can give me that information privately, I'd like to go and speak to that property owner, and maybe we can get that to happen.
Yep, because that's the same thing, it's all engineered, it's all ready to go.
Okay.
Just waiting on those right-of-ways.
Thank you very much.
You're welcome.
Can't wait to hear what you have the patent on. That sounds very interesting, and would certainly get high speed much quicker to people. Thank you.
It's
Thank
not
you.
imminent, Senator.
Yeah,
That's
it's
the only
not.
thing I would
Well,
say.
it's a dream.
It is a dream.
Okay.
I wanted to have a little bit of an upper on this hearing.
Thank you, Dave. Thank you all.
Thank you, Senator Scavello. Senator Baker.
Thank you. Appreciated all your testimony, and everyone's kind of honed in on how do we best target underserved areas so that we're not duplicating and creating more service in an area that already has it. Who should be the entity that is tasked to identify that? And we talk about the governor's proposed an Office of Broadband Technology. Should that be an independent entity? Should it be under the PUC's jurisdiction? Should we have a plan that comes before someone to look at identifying and putting that together? It's just a question whether anyone's thought about that. But as we look to targeting those folks, getting to the people I hear from all the time who are so frustrated, they don't know how to get access into getting people to pay attention and to look to their needs. So just curious what your thoughts would be.
Just a couple notes. One thing, I guess before we started, I've been really impressed by the work of the committee, the bipartisan nature from soup to nuts of everything this committee does. So I think there's a demand and desire by committee members and even the folks from the urban areas that rural broadband is an issue. We need to go out and make sure we look at the unserved areas and help those folks out. So I've been pretty impressed with that. In the work with DCD and the Governor's Office of Broadband Initiatives, it hasn't been any partisan flavor to that at all, which we're pleased with. So whether we want to put something like this under the commission, on all due respect to my friend, the Chairwoman Brown Dutriell, I think I pronounced that right. There's concerns about what they've done with broadband. They're a regulatory body. We had a meeting a year ago with Mark Smith, who was then the Office of Broadband Initiatives head guy in Blue Ridge Communications in Palmerton. And it was funny that the Blue Ridge guy said, listen, you guys need to set up an environment at the state level that we can go out, expand, invest, and make money on what we do. So basically, get out of the way, let us do things. One thing they did mention was the just bonus depreciation legislation that you did last year. Senator Brooks and Representative Ryan, that was a significant positive to our industry, because I had a member from Western Pennsylvania said, because what the governor's office did a year and a half ago or almost 2 years ago now, they invested significant amount of money in Ohio that was destined for Pennsylvania in their budgets. So the legislative work to turn that around on bonus depreciation was a huge benefit to our members, and we're seeing the benefit of that paid off with investment here in the state. So that's a win-win for us.
Maybe to answer your second question here, it kind of strikes me as, and we know this, but when I hear, my friend at Blue Ridge here, if we're putting a cell site in his territory, we would go out for a procurement, and we could use either the telco or we could use Blue Ridge. A lot of the right-of-way issues that you're talking about are very similar, and they go kind of hand in hand in terms of a wireless site, maybe putting up a site in a rural area. We need each other, and we have the same issues, and oftentimes we're customers of each other back and forth. So to answer your question, my experience in state government is if an issue is as important and folks deem it's as important, it needs to be in a governor's office, not within a state agency. And again, I will echo with all due respect to the PUC, but we have issues in a number of agencies, whether it's a DCNR, whether it's a game commission, and agencies not under the governor's jurisdiction. So I think if it's the focus and if it's that important, then it has to be in an area that has that presence and can be seen as important by the agencies themselves.
Thank you, Senator Baker. Senator Hutchinson.
Just real quick, and David, you started down the road a little bit about right-of-way access and access to poles and all that kind of stuff. And in some respects, we might be asking competitors to use each other's things. And what kind of problems does that cause? I mean, they say, well, we're not going to let you use our pole unless you pay astronomical amounts of money and those kinds of things. Is that an issue? I hear that in general terms, but I just wanted to know, and maybe not with you folks, but you've heard it from others who want to provide services to an area, and a local company that could do what they are doing does not want them to do what they want to do.
It's an ever-increasing focus, certainly in our world, as we're attaching more to utility structures and such. And I'll certainly defer to my Blue Ridge and the Cable Association, BCAP, for their thoughts on this. But generally speaking, the private industry can work these issues out. Not all the time, but we generally work these out privately. I don't know if you would agree with that or not, but there are instances where we might need a referee, and I think that's what the commission has done in terms of the recent decision last week that Chairman Brown-Dutrell mentioned.
Yeah, I think that I'd agree with Dave on that. We've seen examples of things that 15, 20 years ago were just a handshake agreement. We wanted to go on 10 poles. We'd call the guy from the local utility. He'd come out. They'd get in the truck. They'd drive the poles, figure out a price, and it would just get done. Handshake agreements. That's kind of changed dramatically in the last 15, 20 years. Now it's much more corporate. The attorneys are involved. All due respect to my legal folks, my legal friends. There's engineering studies, there's surveys. So one concern we've seen a little bit in Pennsylvania, more out of state, is that utility companies in rural areas that may have dilapidated poles that may have been appreciated out 15, 20 years ago, see broadband providers as an opportunity to say, well, if you guys want to put broadband, that's great, but you need to replace the pole. And our guys, again, want to just put string broadband up there, or string fiber up there. We shouldn't be in the business of replacing poles, which is the under the jurisdiction and under the day-to-day operations of the local utility company. And that's been an issue, I know, with some of our members.
Thank you. Just one quick editorial comment. I agree with also what you folks were saying about the Office of Broadband Initiatives. We need a cheerleader and somebody who's going to help us get things done, and not a regulator that's going to slow down the process. So I appreciate your comments in that regard.
Thank you, Senator Hutchinson. And if I could, one last question for the panel. Maps. So we've heard conflicting opinions on maps here today, right? We've heard maps are important. We've also heard that it's consumer demand that's important. You are the people who come and deploy these assets into communities. How do you feel about those maps? Do we need to assure that we get more granularity with those maps, move from a census block to, what do they call these, the octagons or the hexagons that get
Shape files, yeah.
the shape files on top of it? What would you like to see with those maps?
I think I get the bottom line being we want to put investment into rural Pennsylvania. We want to make sure that if there is public investment going in to support a private operator building in rural Pennsylvania, there's not an overbuild over a current provider. I think what the state of New York has done has been pretty brilliant. They've fortunately had $500 million in their pocket to start the process, but they have looked at CAF2, they've looked at extensive mapping on their own right that providers Armstrong in Butler County is now building in a 7 or 8 county area in southern tier New York, just north of the Pennsylvania border, fiber to the home for probably 95% of the folks that are out there. So they're using some extensive mapping done by the state of New York in addition to what the CAF2 did. So I think mapping is important. It's got to be in there. The investment has to be there to identify those areas so providers can look at those. So listen, and as Dave and others have said, look at a reverse auction to go in and to get the minimum amount of public funds that would be available to reduce that amount and get broadband accomplished in the process.
I would agree. If it was a world where there were no public, whether it's federal or state funding of broadband, then I suppose a map wouldn't be critically important. I think consumers would want to see a map for themselves, but that's just not reality. We have the Connect America Fund. If you all determine state funding is going to be augmented, then you really do need a map to Brian's point about unserved and underserved areas.
And then one last question. Representative Struzzi asked this question at our last hearing. I thought it was really interesting, the responses that we got. They were very diverse. We're attempting to, wrap our arms around the size, scope, and magnitude of the problem, identify technologies and means to deploy those technologies, and put a price tag on it. What do you think it's going to cost to, completely cover Pennsylvania with high-speed internet access?
I turn to Dave on that.
I would say the cost is going to be higher if the regulatory obligations and hurdles that we have to jump through are in place. The cost will be lower if those regulatory hurdles are lessened.
But again, the focus on, you've got private operators there that know what they're doing, that economically go out and deploy broadband that meets top level standards of anywhere in this country. We need to look at those folks to be engaged in the process to determine and work with you to see where we're going.
Very good. Thank you very much. Our third panel is making its way up to provide testimony, and the focus will be on emergency response. We're very happy to have joining us Major Edward Hoke from the Pennsylvania State Police, Dr. Joshua Batten from the Fund for the Northern Tier, and Michael DeSabato, Manager of State and Local Government Affairs from Motorola. So, gentlemen, if you could summarize your remarks, it would be greatly appreciated. I'm sure the panel has a lot of questions for you. So, Major Hoke.
Good afternoon, Chairwoman Phillips-Hill, Senators. I appreciate the opportunity to be here this afternoon and to provide you with the Pennsylvania State Police perspective on broadband. Let me begin by saying that the Pennsylvania State Police fully support the initiative to bring forth broadband across the Commonwealth for all of the reasons that have already been stated. The educational benefits, the benefits that are there for the law enforcement, first responder community are without question. From my perspective, and I think it would be very germane to your conversation this afternoon, as this committee is aware, the Pennsylvania State Police began on a very ambitious program of replacing our statewide public safety radio in April of 2017. That was a contract that was awarded at the end of 2016 to Motorola. For the infrastructure to be developed throughout the course of the project would be $44 million. That project began in April of 2017 in the northwest portion of the Commonwealth. There was a pilot program that was began out in the western end of the state with our troops out there, and it proved to be very successful. Since that time and up to and including today, we have 41 counties that have been, that the P25 radio program has been deployed to across the Commonwealth. The projected timeline for completing that project will be in June of 2021. As this committee is also aware, prior to the project for the P25 to roll forward, we currently operate under an open sky 800 megahertz radio system, which has been our primary voice communications means across the Commonwealth since about 1999. That project and that network has been problematic for us from its inception. We've dealt with a number of overcost issues as well as coverage issues for our troopers that have impacted their ability to communicate effectively with the service that they provide to the citizens of the Commonwealth. That being said, that system is still operational. It's also being maintained until we complete the rollout of the P25 deployment. The reason that I mentioned the Open Sky 800 megahertz system, that system currently consists of about 1,100 towers across the Commonwealth. Throughout that roughly 20-year period that this system has been deployed and worked on, we've had to increase our towers in many instances through the use of what we refer to as microcells. There's been some conversation here prior to us coming forward about the use of telephone poles with antennas on top of them. And basically that's what we refer to as a microcell. The Open Sky 800 radio megahertz system currently has between 350 and 400 of those assets in service. Many of those assets are standalone sites. Because they are in such rural areas of the Commonwealth, we can't get electric to them, so we've had to provide an alternate fuel source in the forms of a propane generator. So they're not very cost effective for us to maintain. Fast forwarding to June of 2021, we hope upon the successful deployment of the P25 radio system to decommission that entire system. There will be approximately 120 to 125 towers that will be in play and will be part of the P25 radio program once it is up and running, the system once it's up and completed. So you can see there will be a significant reduction in the number of tower sites that we will be required to maintain. We've been in discussions with DGS once the state police are confident that we no longer have a need for those assets to decommission those. And at that point, they'll be turned over to DGS to do with as they see fit. Of critical concern for the discussion this afternoon, and I was happy to hear this committee already commented on it, is obviously public safety is paramount, and I know this committee recognizes that. Moving forward into the future, with regard to the broadband initiative, obviously the towers that are assets of the Pennsylvania State Police public radio system, statewide radio system, are of interest to those providers who provide those sorts of services to the Commonwealth. Of critical interest to us is that we maintain oversight and control of those assets for the purpose of public safety and ensuring that we have the final say on what would or would not be done with those towers. I can't tell you that, and I'm sure I'm not sure by fate or consequence that we're here this afternoon in Monroe County, but in 2014, Corporal Brian Dixon lost his life not far from here, and Trooper Alex Douglas was grievously injured. As a result of that incident, the Pennsylvania State Police engaged in a 2-month-long search for the person responsible for that. Our communications at that time were exclusively through the 800 megahertz system, which were woefully inadequate for this rural area of this county. We were able to address some of those needs and to bolster our communications ability to some degree, but not as effectively as we would have liked to. So communications is critical to operations, and I know this committee recognizes that. And so from our perspective, we want to ensure that any legislation that's brought forward ensures our ability to protect our interests. Thank you. I appreciate the opportunity.
Thank you very much, Major. Dr. Batten.
Thank you, Madam Chair and Senators. I'm coming here today from Mansfield University in northern tier of Pennsylvania. If you're not sure exactly where that is, can you hear me now? All right. That is in the middle of the mountains in central northern Pennsylvania. The emergency management infrastructure and response system in my particular area includes approximately 2,650 square miles in Potter and Tioga counties. Given the terrain and rural nature of our region, cellular, radio, and broadband connectivity is a challenge. I'm going to get into just a few types of technology where connectivity is limited and provides some concerns. Cellular and broadband connectivity is critical to emergency response and public safety, as the majors just said. However, limitations in current service affect the ability of our emergency services response processes to function at optimal levels. One such example is the I Am Responding cellular application for smartphones. Both contracted and volunteer first responders use this technology to track their activities, detail their location, map emergencies, account for their time and ability to respond, and it allows the user to request additional assistance from their mobile device. A good tool, however, first responders have reported receiving notifications the day after the critical response. Another example related to post-disaster response is Pennsylvania Emergency Management Automated System. It's streamlined the process of reporting these situations, given our first responders' ability to upload evidence, written, picture, video, on scene, and in real time. However, numerous occasions the evidence was not synced to the regional management systems and therefore was not uploaded to the PEMA system and subsequently lost. Emergency management system of Tioga and Potter counties do not currently have the ability to employ automatic vehicle location, which is otherwise known as LoJack, to their first responder vehicles due to the limitations in connectivity. AVL accounts for their location of all first responder vehicles in real time, enhancing the ability of dispatch personnel to optimize their effectiveness of responses in critical instances. Radio connectivity, although not inherently related to broadband, does incorporate broadband connection technology to enhance range, otherwise known as IP radio. The Tioga and Potter County Emergency Management are currently constructing their own system of towers and infrastructure to allow first responders to communicate with each other across the jurisdiction. One example is Mansfield University is a 175-acre campus overseeing the second largest town in the county, and there's actually a dead spot on campus where there's no radio, no wireless, and no broadband or cellular activity. Another area that I'm here to talk about is public health. I believe it'll be talked about in the next panel. Our regional EMS practitioners have reported health monitoring systems and telemedicine delivery to be limited due to the connectivity issues in our rural areas. Data from the home device cannot be relayed from the monitoring systems, restricting their ability to provide real-time medical assistance if needed. In addition, telemedicine and consultation is limited. Emergency management training, which is my background. I've been training emergency management personnel and first responders since 2009. As a result of the lack of trainings in our particular area, if you think of Pennsylvania as a map, you can see the training sites across Pennsylvania in a U shape, going from Erie to Pittsburgh, across to Harrisburg, over to Philadelphia, and up to the northeast. Mansfield University sits at North Central, directly in the middle of that void of training sites for our first responding practitioners. We created the Public Safety Training Institute to address the void in the training. What we were finding is that we were exporting our first responders to our training sites in those locations in that U shape when we could provide it right there at Mansfield University. In the last year and a half, we've provided over 22,000 instructional hours to almost 1,000 first responders in the last year and a half, like I said. With that, we've also attempted to be advanced, incorporating virtual reality technology. We're building a virtual reality laboratory on campus. We are the only of the 16 Act 120 municipal police academies. We're the only ones that use virtual reality to augment our trainings. It is not a replacement for practical experience, but virtual reality is very good if the right system is purchased. On campus, our connectivity is very good, so we can use this technology on campus. But if you go off campus and we try to take this kind of on the road, so to speak, some of our agencies have asked that we provide trainings on site, for example, at a fire department, and we're not able to do that because of the connectivity issues. In fact, we had difficulty finding the ability to provide PowerPoint at one of the locations. So it is very real. So in general, related to the connectivity concerns of the Northern Tier, we're used to working together, organizations, agencies, elected officials, and I would suggest a collaborative approach in our area. We're accustomed to it. Thank you.
Thank you. Mr. DeSabato.
Thank you. Good afternoon, Chairwoman Phillips-Hill and members of the committee. I appreciate the opportunity to present today to discuss Motorola Solutions' perspective on the need for public safety to have reliable broadband access. Before I get started, it's important for me to reiterate that while we have many partners across the Commonwealth, my remarks today are looking at public safety technology broadly from a Motorola Solutions perspective, and I do not necessarily represent the views of our state and local agency partners. At the core of our business, and what the major touched upon, is that and what we've always been known for in public safety is land mobile radio. It's the push-to-talk radio capability that our first responders utilize and depend upon to support daily operations. We are currently working with Pennsylvania State Police in rolling out a new system across the Commonwealth known as StarNet, and there are also a number of local standalone systems that can connect directly to StarNet for interoperability between state and local agencies. When available and feasible, fiber can be used as a redundant connection between radio frequency tower sites, typically in addition to a wireless microwave backhaul network. This creates another option for segmented redundancy, where if a catastrophic event were to unfold affecting the microwave network, a system could rely on the redundant fiber connections keeping communications online. Today's technology in land mobile radio does offer low bandwidth data capabilities. Through an LMR system, GPS coordinates can be shared with dispatch, radios can be reprogrammed over the air while in the field, text messages can be sent to end users, and emergency alerting sirens can be activated. Through the collaboration of LMR and LTE broadband, the capability for additional data sources to be integrated on scene is an exciting prospect, not only for current but also future capabilities. Even when complemented by broadband, LMR will continue to be the platform for mission-critical voice communications. In order to showcase how broadband and data capabilities augment public safety operations and situational awareness, our submitted testimony walked through a hypothetical incident. However, in the interest of time, I've pared down my opening remarks to touch upon a few of the highlights. As states and localities move into Internet Protocol or IP-based next-generation 911 and away from legacy copper wire and 911 infrastructure, the data capabilities begin at the public safety answering point, also known as the PSAP. By moving to an IP-based infrastructure, this allows additional information to be received by the PSAP from a 911 caller, such as pictures and video, and better location information from where a call is originating. Data sharing between the 911 call taker and dispatchers through the workflow between systems is best achieved through a wired broadband internet connection. This allows for information input into the call handling system by the 911 call taker to be seamlessly relayed to the computer-aided dispatch system, where a dispatcher can then share the information with first responders in the course of their response via the land mobile radio network. The information can also be displayed on the first responders' mobile data terminals in the vehicle through an LTE connection. On scene, dispatchers can be alerted through their CAD software of events such as lights and sirens being activated in a vehicle, a body-worn camera being activated, a weapon being drawn, a vehicle having been in an accident, and more. Personnel in the dispatch center can also stream in-car and body-worn camera footage or access camera feeds to get additional information about events transpiring in real time. Post-incident data storage, video, digital evidence, analytics, and records management are all contained in the highly secure cloud-based command center environment. While on-premise storage solutions are possible, the greatest efficiency and cost savings come from a cloud-based architecture that requires reliable broadband access. With incident data stored and accessible in one location, cloud-based data analytics software can work through the data, identify trends, and help public safety leaders better allocate resources and plan for events. In rural communities, distances tend to be greater to essential services and response times can be longer. Internet of Things technology can give public safety headquarters greater visibility of what is transpiring on scene in order to dispatch support before an officer even requests it. Staged drone assets can be deployed to get eyes on scene before an officer arrives, and telemedicine can be the difference for an individual suffering a medical emergency when specialists can be engaged in real time before they even reach the hospital. These are just a few examples where broadband data connections, both LTE and fiber, can play a role in the increased efficiency and situational awareness of public safety. I appreciate the time to provide our perspective on the nexus between public safety and broadband, and I'm happy to answer any questions the committee may have.
Thank you very much. Senator Baker? No. Senator Hutchinson?
Thank you. I wanted to ask Major Hoke about, my understanding is where the rollout of your new system began was Warren County was early county, and one of the things that I thought is an excellent idea is to allow the local 911 center and county emergency management folks to piggyback on some of the things you're doing. I would ask if you could describe briefly what that was, what you allowed them to do. I was curious as to whether other counties are doing a similar thing, and I especially with Dr. Batten sitting right next to you, wondered if there was any way that your rollout could help them provide better services at a local level.
Our Bureau of Communications and Information Services oversees the StarNet radio program. And part of what they do is an outreach to our federal, state, and local partners to show them the benefits of what it would mean to their agency and to the Pennsylvania State Police if they were to join in and become part of the P25 program within the Commonwealth of Pennsylvania from a cost savings perspective, but more importantly from an radio interoperability, the means to communicate back and forth between the various agencies is critical. That's something that's been lacking across the Commonwealth for far too long. And our goal is to recruit as many of those individuals at no cost to the 911 centers to get onto our towers. And we in turn would ask if there's a need for us to utilize some of their radio assets to afford us that same opportunity. So it's been to date, I believe there are 5 counties that are participating. But again, this is still a work in progress. It's very young. Our total project, again, has a tentative timeline to be completed in June of 2021. So we're, again, about 42 counties across the Commonwealth where P25 has already been deployed. So we're hoping that as the program becomes more developed, we can leverage those partnerships going forward.
Dr. Batten, would you
I'd like
comment on
to
that, please?
add to that as well. From my understanding is the procurement of the radios that actually connect to that particular system is somewhat a barrier for some of our local EMS providers. But there are grant money available that they do seek out, but that is one comment that I've heard to that.
But they are aware and would like to do that but there are constraints.
There are.
Is that a fair statement?
They're easily overcome, but they're there.
Okay. One other quick comment, Major, you said the abandoned assets. So the state police will completely walk away from that, and DGS will control those abandoned towers. And because it's funny because I was in a meeting a couple weeks ago by a local, it's a nonprofit that does do internet service providing to rural areas, and they thought they are interested in using some of those towers that'll be walked away from it, and I'm hoping that those are widely available to folks. As I say, I'm gathering from what you said that's really it'll be DGS doing that, right?
Correct. Once we determine that the asset, whether it be a tower or a microcell, has no bearing on the P25 deployment, we will no longer have a need for it. So we would be more than happy to turn that over to DGS. Some of these locations we pay a rent to have a tower and or a microcell on a property. In addition to what I had mentioned previously about the operation of the site itself by an alternative means of powering up that source.
Thank you.
Thank you, Senator Hutchinson. Senator Scavello.
Just to follow up, Major, you mentioned what happened here, and you folks did a phenomenal job, and I just hope that something like that never happens in this county again. The P25 system, because you knew that there was a major problem here with the 800 megahertz. Excuse me. Do we have the P25 here yet, or is that on its way?
It is on its way. It is not deployed yet to Monroe County. As I said, we started it in the northwest portion of the Commonwealth and have been working south and across the central part of the state, and we're making our way up here to the great northeast.
Any idea when we can expect it?
I can provide you with a better time frame, but it will be before June of 2021, sir.
Okay. Thank you. Thank you very much.
Thank you, Senator Scavello. I'm hoping that you could speak to the PA StarNet program in a little more detail, and if you could explain the difference between this and Open Sky. How is it different, and what things are you changing to ensure that what happened there isn't going to happen again? So often we hear, that conversation about, $800 million wasted, and how are we going to make sure that we don't repeat the mistakes of the past? And also for us, when we're, of course, looking at different ways that we're going to deploy technology, we want to make sure that we learn from the mistakes that you've made so that we don't go forward and repeat them again. So if you could speak more broadly, and I do have to say thank you both, Major Hoke and Mr. DeSabato, for making the opportunity available for members of emergency preparedness and communications and technology to get a little closer look at what you're doing with the radio system upgrade. So thank you for that. It was very instructional.
Senator, I'd be happy to answer that question for you. The numbers that I see are a little more around $855 million in cost overrun for that system, which began, again, according to my records, back in 1999. To be clear, the Pennsylvania State Police did not take ownership of the StarNet program until 2012, at which point we recognized that there were some significant issues with the coverage issue, which we knew about because we were one of 22 agencies actually that were utilizing that system. Although we had a seat at the table, we were not the oversight of that program. Fast forward to 2012, when we were given the authority for the StarNet program. We immediately began to make some changes with regard to improving our capabilities by introducing a VHF radio into our patrol vehicles to allow our troopers the ability to communicate in those areas where they could not with the 800 megahertz system. The 800 Open Sky radio megahertz system is a proprietary system. It can provide for data transmission, but in a very limited manner. It's not a very robust system for transporting data across the system. Additionally, as I mentioned, 800 is the Open Sky is proprietary, which meant that we were locked into utilizing specific equipment for that system. That in and of itself hampered our ability to provide interoperability among other agencies. The P25 system is a non-proprietary system. It opens the door for not only law enforcement community, but all first responders to get onto this system in times of a major catastrophic event somewhere in the Commonwealth or even in this country, and would allow them to communicate across jurisdictional boundaries, provided they were on the designated frequencies. It also does not limit a first responder agency or a law enforcement community agency from settling in on a specific vendor. It doesn't have to be, for the sake of this conversation, Motorola, or it doesn't have to be with some of their competitors. Many of these manufacturers offer P25 radios at varying price ranges and various price points. You know, again, maybe to fit with budgets that would allow for them to maybe look at that technology and to put that into the hands of their first responders. So it doesn't lock them into that monopoly, if you will, for one company having exclusive control over the system and the equipment.
Thank you. I appreciate that. And
One
if
thing
you certainly have anything to offer, we would be very interested.
Sure. One thing I'd just like to add to what the Major is saying in terms of containing the cost overruns of the last system, we are currently doing a lot of the build out at risk. So we are not being paid until the Major and Major Stackhouse sign off on doing coverage testing for each troop as we make that run around from the northwest down around through Philadelphia, where we're at now. So we build it, they test it, and then we get paid. So we're not paid up front for anything.
Thank you. Senator Baker.
Thank you. I would like to follow up, obviously, with the terrain issues we have here in northeastern Pennsylvania. Have you run into any of the similar challenges that we saw with the manhunt here and the frustrations of law enforcement not being able to communicate during that very difficult time, which we're coming up, unfortunately, on that very sad anniversary of the loss of our troopers. So are we seeing any of those challenges like we did with, or is that something that you expect to have addressed? Because our terrain here is obviously very, very challenging.
Senator, I'll turn it over to Mr. DeSabato here in a second. But I do want to let this committee know that Motorola has been a very good and diligent partner with the Pennsylvania State Police in deploying the P25. We have set some very high benchmarks in light of the things that have occurred in the past and that we did not want to see repeated. There is a 95% coverage mandate that we impose on Motorola to make sure, and this is actually, I was very impressed to learn how this test is done. There's actually a grid map of every county that is developed by Motorola in conjunction with PSP, where they actually go out and they drive into that physical location, and you know they actually conduct a radio transmission to see that if it's heard on the other end. And if it's not, then there's an issue, and they have gone to great lengths to, I believe, to my knowledge, erect at least one additional tower to the tune of over $120,000, again on their dime, to meet that threshold for us. So we're very appreciative of the work that they're doing. I believe they are a good partner, that they understand the significance of the public safety operation here in PA. Senator, to your question, the geography of this Commonwealth is amazing. It really is. And obviously we're so large, it varies from county to county. Those types of concerns are our concerns as well, but we rely on the engineers from Motorola to come up with a solution for us. And I'll certainly open the floor to Sorry,
Thank
go
you.
ahead.
Yeah, so we started with the pilot in Warren County, and that was essentially one of the first gauntlets that state police threw down at us. If you could pretty much cover Warren County, you're going to have a pretty good shot at going elsewhere throughout the Commonwealth. And I think when it's all said and done, we had to add one additional tower up there in Warren County. But again, that was on our dime. We have a lot of really good engineers that work for us, and so we added one tower to add additional functionality up there, and we will cover, like as the Major was saying, 95% of the Commonwealth. That is 95% of the area of the Commonwealth, not the population centers or anything along those lines. So we'll cover 95%.
And in the case of the other 5%, is that a dual radio in a vehicle or a dual system that you have interoperability with? Is that how that would work?
State Police is utilizing what's known as a DVRS. It's a digital vehicular repeater. And what that does, that allows a couple of things. State Police to leave their vehicle with their portable radio, talk to the digital vehicular repeater, and use the power of the mobile unit in the vehicle to hit back up to the towers. So the system is built for mobile coverage. An interesting thing about these DVRs is you can set one to be the primary in various different areas. So if you do end up in a situation where you're in an area that maybe does not have great coverage, you can move one of the vehicles, activate that as the primary, to then utilize that as your launch point, essentially, for the portable units to hit that DVR and then back up to a tower. And then within that, the 95% coverage, it's not always hard and fast. The thresholds that we have to meet to make coverage is what we're gauged off of. So there are some areas where it's in that 5% range that you still might be able to get a transmission out or receive a transmission in. It's just for the standards that state police have set for reliability, hitting your 5.9s, your 99.999% of reliability. That's where that threshold comes into play. I don't know, Major, if you have anything to add.
No, and to be clear, we want to be very confident once the P25 is fully deployed that will be our single means of communication, other than through our in-car broadband connections. But for the purpose of public safety communications, PSP's primary means of communication is voice radio.
And as technology changes and your engineers advance the system, how do you upgrade that to our current system? Is there a plan in place for that as you move forward with any new changes?
To keep the system current?
Yes.
So there is an upgrade path. When the system is completed, I don't know what software vintage they'll be at, but there'll be a software where it will be able to be upgraded every year, every 2 years, however they want to do that. I believe there's an agreement in place to where those updates occur automatically every 2 years. That includes components that are akin to what you would find in a server closet. These systems are very much IP based. And so it's just a matter of a software push over the air when state police are ready. And then it's a change out of some of those aging components. Part of a P25 architecture is that it's built with off-the-shelf technology. And that was one of the big changes. So you're using your standard routers that, a little higher grade than what you get at Best Buy, but that, for the sake of argument, they're not Motorola proprietary routers. They're not Motorola proprietary servers that are going into those server closets. And the benefit and drawback of that is, while we can't control when things go out of support from another manufacturer perspective, it can allow additional resources to be put onto the system. You're not locked into a single vendor, much like we're not locked into a single vendor for routers or servers or anything along those lines. So to better answer your question, so the system will be is at a place where once it's completed, it will be able to get a lot of these updates over the air.
And Senator, just to follow up, Major Diane Stackhouse, who oversees our Bureau of Communications, recently worked with Motorola and DGS to broker a maintenance agreement to do exactly what you're talking about here, to keep the system operational and to keep it refreshed for us.
I appreciate that. I mean, I think all of us, if we're making that investment and the lives of troopers and other responders are on the line, we want to make sure it's up to date, absolutely current, and available. So thank you.
Thank you, Senator Baker. Thank you to our panelists. Very much appreciate you being here today.
Thank you.
Do you have any complaints about their computers, their computer system?
season, so I'm not going to shake your hand. Thank you.
Welcome to our final panel of the day that's focused on healthcare perspectives. And joining us on this panel are Deputy Secretary Sally Kozak from the Department of Human Services, Office of Medical Assistance Programs, Dr. Danae Powers, President of the Pennsylvania Medical Society, and Phil Witkowski, Director of Telehealth from St. Luke's University Health Network on behalf of the Hospital Association of Pennsylvania. So thank you very much for being here today. Appreciate your testimony. And we're a little off schedule, so if you could be concise and succinct, we would really appreciate it. Thank you very much.
Certainly.
Deputy Secretary.
Chairwoman, Senators, thank you for inviting us here to talk today. I'll touch briefly on two areas where broadband impacts us within the medical assistance program. First is with the provision of care to over 2.9 million medical assistance recipients. Many of those individuals rely on telemedicine services for consultation, specialty type visits that may not have immediate access to. And the other piece is with home monitoring programs. The remote monitoring programs allow organizations and providers to check on their patients, get information on them in real time, and do interventions before a problem actually becomes bigger than what it needs to be. We actively support and pay for those types of programs within the medical assistance program, and we do so because it has been demonstrated to improve outcomes of care, improve access to care, as well as offer convenience sometimes for patients that aren't otherwise able to travel. We've had a good response to those programs. However, we have also heard from providers and patients that while they are willing to use those types of telemedicine services, they can't because they don't have access to high-speed broadband. So that's the first area of impact. The second area of impact is with our eHealth program. As you may know, we were legislatively mandated to create and maintain a secure health information system, which we call the PA eHealth Authority. Sitting in the center of that eHealth Authority is the Pennsylvania Patient Provider Network, or what we call the P3N. So the P3N is the connector between all of the health information organizations that are scattered around the state. And so as folks are seeing their physicians, all of the health information that's being gathered, their diagnosis, their vital signs, their lab work, their medications, are all being shared within those health information organizations, or HIOs. However, when a patient leaves that particular network of health information organizations, it's then the P3N that facilitates that exchange of information. So, for example, if I get sick in Pittsburgh when I live in Philadelphia, the Pittsburgh provider will be able to pull up my information, and that comes through the P3N, the gateway. We have partnered with the Centers for Medicare and Medicaid Services over the past several years to give over millions of dollars in grants to onboard providers to the health information organizations, as well as to help further develop the capacity of the health organizations. So, for example, we have one HIO that is currently getting ready to start sharing digital information within its own network, so that if I break my arm and my orthopod needs to refer me to another orthopod, the x-rays are right there for them to see. So convenience for the patient, improvements in quality of care, better care coordination throughout the entire system. Patients will also have access to that information and be able to share it and help manage their own care as well. Managed care organizations, payers, they all will have access to that information as the Secure Health Exchange continues to grow. We have not currently heard of issues with broadband that are preventing providers from joining an HIO. However, we are concerned that as the capacity of the
health information network continues to grow, and the breadth of information that is being shared and stored across systems, that if we don't have adequate broadband, that people will not recognize the advantage of it, and we won't see the improvements in care that we would hope to otherwise see by being able to share that information. So for us in the future of our telemedicine and e-health programs, reliable, affordable broadband is important to their future. Thank you.
Thank you very much. Dr. Danae Powers?
Yeah, hi. In light of the fact that we're running behind schedule and your statements, you have the testimony. I will probably synopsis it, but of course afterwards, if you need me to clarify anything, ask questions and I'll go into detail. So first, I want to thank you, Chairman Phillips-Hill, for having this, and Senator Scavello for kindly hosting the session. As it was stated, I'm the president of the Pennsylvania Medical Society, and I represent approximately 22,000 members or physicians, students, and practitioners across the state. I currently work in a rural setting myself. I'm a board-certified anesthesiologist. I live in State College, and I provide care to communities smaller than State College, so I practice in a rural environment. And the issue of broadband is very important to us as a medical community, particularly when we intersect it with what's happening and our hopes for the future of telemedicine. We live in a time where it's becoming apparent that what we call social determinants of health can have an impact on the longevity that a patient can expect or a community can expect. And we also have access to care issues arising, particularly in the more rural areas or in patients that have needs for very specific subspecialty intervention. The access to a broadband internet connection that is reliable, efficient, and comprehensive can be truly life-saving in these types of situations. So you can think, for instance, of a patient that, let's say, is a child that needs a subspecialist. The parents are rural. Travel has implications. There may be hindrances to travel. The pediatrician who is in the rural community doesn't have the expertise necessary. The ability to tap into an effective broadband network that could allow telemedicine to bring the expertise of, let's say, someone at the University of Pennsylvania to that parent and that child is huge. We also have systems now where, for instance, there's the golden hour. Someone has a stroke. They need to be evaluated within a certain number of hours, be worked up, and get the treatment available to them. Again, broadband would be effective in that situation. We find that even in urban areas, you might need specialty expertise that broadband would have to be very effective for. For instance, a high-risk pregnancy, the mother can't travel because of financial considerations, and the expert might be in Philadelphia from Pittsburgh or in Philadelphia from Johnstown, and we would need the broadband interconnectivity for that. And I can tell you there are huge areas of rural Pennsylvania that not only do not have effective broadband, they don't even have good cell phone coverage. Because I drive through it, and there's stretches, I tell people, the next 14 miles you won't be able to get a hold of me. And it has been difficult to get the companies to bring the technology out because they're worried about their profitability if they have a sparse need. But I think that they're a little short-sighted. I think we get that broadband out there, you're going to see all sorts of things springing up. And from my perspective as a physician, it will allow us to attract and keep physicians in rural Pennsylvania because they won't feel they're all alone. I'm out here, I have no specialty coverage, what do I do? It's more likely for them to say, I'll go out there, I have broadband, I can connect with people, and they can maybe have some of the excitement of being the first-line doctor for a lot of what doctors like, which is the interaction with the patient. So it would be very important, and we really support your efforts and appreciate your looking into this and pushing for it. Thank you.
Thank you very much, Dr. Powers. Mr. Wachowski.
Thank you. Good afternoon. My name is Phil Wachowski. There we go. Sorry. Good afternoon. My name is Phil Wachowski. I'm the Director of Telehealth for St. Luke's University Health Network. My focus at the Health Network is in two-way interactive video. So I appreciate you allowing us to speak this afternoon, sorry. I originally had this set it for the morning. Okay. A part of my discussion today, I hope to provide a little bit of an overview of telehealth and the future of healthcare, and to offer our support in the expansion of low-cost, consistent consumer broadband enhancing access to health care. First off, what is telehealth? The American Academy of Family Physicians defines telehealth as the broad collection of electronic telecommunications supporting healthcare delivery from a distant location. Using telecommunication to communicate to the consumer's information in healthcare is not a new concept. References to telecommunication in healthcare can be found in medical articles since the dawn of telephony. Our ability to have a telephone call with our physician has grown to include a host of technologies, including email, instant messaging, remote monitoring devices, and increasingly the ability to have a two-way interactive video conference call. Okay. Why is telehealth important to healthcare? With many of the community hospitals and health clinics finding difficulties recruiting physicians, limited funding, and low patient volumes to support hiring specialists, telehealth offers a way to bring urban medical community physician skills to rural hospitals and clinics. The American Stroke Association stated, telestroke is one of the most important applications of telemedicine, bringing the experience of stroke experts to hospitals lacking appropriate stroke expertise. Studies suggest in one healthcare, the consumer learns specialized services are available to their local hospitals or clinics. They are less likely to travel out of the area for care. The result is a higher utilization of local services and sustaining revenues for that facility, reducing patient transfer costs, and a complete reduction in hospital readmissions. Okay. In addition to the benefit to hospitals and clinics, telehealth will increase access to extended home health care services to the home, as many of our aging citizens elect to remain in their homes. Delivering healthcare service models to support home care is a critical need. The AARP Public Policy Institute published an in-depth article outlining the benefits of telehealth in post-hospital care. They cited the reduction in travel challenges for primary care, supportive family caregivers, and a Journal of Pediatric Psychology study found that mental health services delivered using telehealth can contribute to the reduction in stigma associated with seeking medical health care and could result in increased utilization of services among adolescents and young adults. Despite the studies outlining the tremendous benefits of telehealth services, there are still several barriers, more significant program development and considerate adoption within the Commonwealth. Concerns preventing widespread telehealth program development in Pennsylvania include the lack of a state legislation defining telehealth as a modality, legislative support for telehealth payment parity with face-to-face provider visits, and the final implementation of the Physician Licensure Pact. Among the top barriers for expansion of cost-effective, life-saving telehealth technology is access to low-cost, consistent, high-speed internet. The AARP has acted as a consistent advocate for greater access to broadband services for seniors in rural areas across the nation. The Commonwealth is no exception to these access barriers and adoption of telehealth. St. Luke's University Health Network supports the legislative efforts to create low-cost, consistent, high-speed broadband access to all Pennsylvanians, regardless of where they live, with this technology enabling access to high-quality health care. I appreciate the opportunity to speak to the committee, and thank you for your individual members' time. I'm open to any questions.
Thank you very much, Mr. Witkowski. Senator Scavello.
Thank you all very much. I truly believe in telehealth. I've seen it in action, and especially in the rural communities, and I know the importance, and I appreciate your testimony. Secretary Kosak, just a question. Are we looking into the computer systems in the local offices? They're obsolete. When they go into one and they try to go into another, they drop, and the staffs are complaining like crazy. I would appreciate if you can bring that message back and look at the systems. You could probably save a tremendous amount of employee time and get better results.
Thank you for that feedback. I'll take it back and have conversations with our e-health folks.
I appreciate that. Thank you very much.
Senator Baker.
Thank you, Dr. Powers and Mr. Witkowski. I have long supported HAP's effort in regard to telehealth, and especially as someone who is looking at the rural health hospital model that we are all hoping will advance through the General Assembly this fall. I constantly hear about access being created through telehealth. And I think when you look at the other applications, both behavioral health, to your point of adolescents seeking treatment, I think those accesses at a school location where the child is, not necessarily where the service should be delivered in a certain area. You could utilize telehealth for psychiatry, for all sorts of things. So I know the stroke component has been highly successful, and one of our counties here in the Northeast, Pike County, is having conversations with a Philadelphia hospital to help deliver forensic pediatrician services at their Children's Advocacy Center, something that you would never anticipate. So I think it's long overdue. We have to give a shout out to our colleague, Senator Elder Vogel, who has been the champion of this. And to your point, yes, we need to define it. Yes, we need to appropriately pay for it. And yes, we need to make this the norm. So thank you.
Senator Hutchinson.
Thank you. I was just curious, Dr. Powers, do you use telehealth in your practice? Does that work in your kind of practice or not? I'd be curious to hear an example of some way you have used it, or maybe a colleague used it or something of that nature.
I'm not sure you'd call it telehealth, but what I have done is had situations where something very unusual had happened, and I reach out to experts. I can tell you a story. I had a young child, 6 weeks old, was coming in for removal of an extranumerary digit, had a very unusual reaction in the operating room to the anesthetic. We had our local experts who were in the area come in, the pediatricians, and recommended something that I wasn't comfortable with. Reached out to the University of Pittsburgh, got a hold of one of the pediatric anesthesiologists there. He described a situation that occurred 1 in 500,000 times. It was due to a congenital anomaly, and he said to us, the smartest thing you did was not listen to that advice from the pediatrician, because it would have, so in that sense, I consider myself well-trained, well-qualified, but this was an extremely unusual thing. It needed an extremely narrow level of expertise from a real expert, and thank God we were able to get him on the phone. So this is the kind of stuff, though, I say, you look at what this could do just across the board. I've seen people call out from the operating room with unusual diagnoses and call out to Hershey and get an orthopedic pathologist on the phone and say, what are we dealing with? And when I look at this and think, can you imagine what would happen if we had true broadband, true telemedicine, true interaction with visible, true ability to transmit the information and the data? We could bring the expertise of these areas into my little hospitals where I work. And the other thing people don't understand is I see lots of patients who will not travel. They just won't. It's not that they don't care. It's not that they don't love their loved ones. It's just not on their radar to drive 80 or 120 miles to go somewhere. And they gamble. They play the odds. We'll really be okay. Well, they're denying themselves care. So this could be, to me, game-changing.
And Mr. Witkowski, I do appreciate the fact you talked about mental health and psychiatric care. My understanding is there's such a shortage of psychiatric practitioners, and it's getting worse and worse. I think that this could be a way to bridge that gap, so that those in rural areas that certainly could not, there's no doctors within hundreds of miles, but those patient doctor provider relationships can be built up in a virtual session, including my local prison has talked about, how do we make access to mental health services for the folks staying at the prison, and technology is a way to do that. Thank you.
Thank you, Senator Hutchinson. Thank you. This has been really helpful panel, and I agree with Senator Baker. Senator Elder Vogel has done a wonderful job and came very close to getting telemedicine legislation over the finish line, and we hope that we'll be able to accomplish that this session. Just a I have a couple of really targeted questions. Dr. Powers, if I could, last session we passed legislation that required medical providers to electronically prescribe controlled substances. Have heard some concerns with regard to that legislation. You know, I think when you talk to the average suburban mom who has a child who's on attention deficit medication, it made a lot of sense. It was a lot easier than them having to go and physically pick up a prescription from a provider and go to the pharmacy themselves, and that there is some benefits to having electronic prescriptions done in terms of safety and security. But can you talk about any comments or concerns you may have or have heard about how the lack of universal broadband internet access is impacting physicians with that recent, I think it was Act 96 and e-prescribing?
Yeah, I could actually. The intent of the act, I think, was good, and some of the legislation makes sense. And obviously, to e-prescribe, we need good broadband. It has to be reliable, efficient, and omnipresent. So in that sense, I think it's going to meet some of the objectives that were initially built into the legislation. I have been hearing some concerns because obviously you need more than just the broadband. You also need a way to write the e-prescribing, and that usually requires electronic health records. And there are a number of practices, particularly rural again, that are smaller, that don't have the robust financial backing that would be required to implement an electronic health record in EHR. These systems can run, the cheapest I've heard is $40,000, and they go up to hundreds of thousands, and then when you get into the larger systems, they go into the millions. So there are practitioners that are with systems that have cash flows in the billions, and then there are practitioners that are looking at, you know, an extra $300 means the difference between this and that. So one of the concerns we've had is, my understanding, and I've read the legislation, is that it was written that if you either did not have broadband or electronic health records, you would not be required to e-prescribe. My understanding is that the Department of Health is interpreting that as you do not have electronic health records and broadband. So that would require people who have broadband but not EHR to e-prescribe. And I've already talked to a practice that said to me, and they're somewhat rural, they cover about 25 miles of patients, you know, their patients come from 25 miles across, that because they don't have EHR and they're not going to put it in, that they're just going to stop prescribing. So their patients that need controlled substances won't be able to get them, and there's already an access problem. And I told them that we would work to try to make sure that the Department of Health backs off. I think they're misinterpreting the intent of the legislation, because I would hate to see that legislation drive a worsening of access to care.
And I appreciate that insight very much. When that legislation went through, I think that the majority of us looked at that and cast that vote thinking that it was an or and not an and, because we recognize that, you know, small rural physicians don't always have access to a large hospital system with EHR. So thank you. That's very insightful and something, you know,
Maybe we can work together to
we can certainly follow up on. So thank you
appreciate it.
very much. If I could, so often we like to make decisions based on the data. And we often hear that people who live more rurally without access to high-speed internet can't have their pacemaker defibrillators connect, so they can't transmit that data to their physicians, you know, live. They have to go in weekly or bi-weekly to have them downloaded and read. So I'm wondering if there has been any research done on how, you know, pacemaker defibrillators and other medical devices work, how it works in areas where people have access and how they work in areas where people don't have access, so that we can look at the relative health impacts as well as the cost, particularly with our Medicare and Medicaid populations. Is there anything out there that we as decision makers can look at?
Within the medical assistance program, we have not historically looked at that type of information. It's possible that our managed care organizations might have that information, or it's possible that we can get at it through the encounter data. That's certainly something that I can take back, and we can follow up on our ability to take a quick look at it.
Yeah, I think that would be really helpful, because I think that one of the things that we hope to achieve with telemedicine is improving health outcomes, but also recognizing that one of the largest growing cost segments of our state budget is medical assistance. And if we can improve health outcomes and reduce care costs through technology, that would be a win-win for everyone. So that would be really helpful, and I would appreciate it very much. I just have to say to you all, thank you very much, and to the folks who've taken the time out of their day to come in and listen, to those who are going to be watching later on online when we post this. It'll be posted for everyone to review. Thank you, and we'll just find my place in all my prepared questions and remarks. My goodness. Long pause. I would be remiss if I didn't thank Senator Scavello for requesting that we hold this hearing here. I didn't really know the significance of this building until I got here today, but it certainly was a very appropriate place to hold this hearing, and I appreciate it. To Senator Baker and Senator Hutchinson, thank you for attending this hearing today. And I would like to now recess the Senate Communications and Technology Committee to the call of the chair. Thank you again.